Kalau saya tak dapat this program, saya tak tahu how happen to my mom, siapa nak take care about dia ketika saya bekerja. And then saya pulang pun belum tentu lagi saya boleh hilang risau tu. That's why saya rasa gembira sebab yelah saya tak perlu risau tentang dia. And then semua everything yang apa cover by CSR. Dari consultation doktor, medication, terapis, and then bilik for my mom sekali. And then saya sangat berterima kasih kepada ReGen sebab willing kasih saya sponsorship untuk my mom masuk ke under CSR program. Sebab saya pilih inpatient daripada operation kerana mak saya akan lebih terurus, lebih dapat penjagaan sepenuhnya kerana saya pagi saya bekerja, and then during pagi mak saya boleh dijaga oleh nurse dengan assistant nurse, and then dia boleh buat fisioterapi tanpa saya risau lah. Sebelum masuk ReGen dia ada stroke separuh badan. After lepas kami buat rawatan di ReGen, tangan mak saya boleh bergerak, kat barang boleh bergerak, boleh genggam tangan. Before ni tak boleh genggam tangan. And then for the kaki pula boleh ke kiri, boleh ke kanan, and then boleh angkat juga kaki dia. Before ni adalah dia tak boleh bergerak langsung kaki dia, and dia tak boleh rasa. After buat rawatan, kaki dia boleh rasa. Adalah pencapaian yang terhebat bagi saya kepada my mum.
Puan Sarina was our patient, which she was admitted for left-sided paralysis on the 14th of August, and she was discharged on 3rd of October. That is approximately about 1.5 months stay here in the Ward 2 ReGen Rehab. So what we liked and what we realized about her improvement is that yes, I would not deny that she took time to recover, but most importantly, we could see her progress in a weekly basis. As I mentioned earlier, here we practice IDR, where we have interdepartmental communication, and we set small goals in a weekly basis for us to see in 1.5 months a big goal and achievement. So for Puan Sarina, she actually came in a situation where she had slurred speech, and also she had left upper limb weakness and left lower limb weakness. But the most important difference that we could see in her is that she was not able to utilize her daily living. She was not able to do many things on her own. She needed many assistance in terms of her personal hygiene, in terms of her nutrition. But as she stayed here and as we go along with her in the treatment, we realized on 3rd of October when she was discharged, she was able to eat independently despite having the weakness on her left limbs. She was able to manage her personal hygiene in terms of showering, brushing teeth, and washing her face. Also in terms of her prayers, she was able to do her prayer with what she has, with all the weaknesses that she had. Despite that, she was able to do her daily routine. Sometimes in stroke, we will not be able to see patients going back to normal 100%. But what we want here and what we aim here for family and patient is for some improvement that able to make them live for the rest of their life with happiness.